The facelift experience is typically a once-in-a-lifetime experience for patients, sometimes two, on rare occasions, three. And so patients are worried. They do get nervous. Having our outpatient surgery center connected to our office is an element of comfort. For patients, all the care is in one building. All the doctors that are taking care of you are in one building. We just opened a brand new surgery center. We call it Grassland Surgery Center. It is very private and exclusive. It's much cleaner. You get specialized staff that knows everything about plastic surgery. You get a very private, exclusive experience. We have a board-certified anesthesiologist, so you get all the safety of a hospital, but the privacy and exclusivity and cleanliness of an outpatient surgery center.
I have just gone through a big weight loss journey, and I've lost 60 pounds. And I love the way my clothes fit and that, but when I look in the mirror, it doesn't match how I feel. You know, everything fell. You know, my face fell, my neck fell. So when I look in the mirror, although I feel like I'm in my 40s, I look like my grandmother, and it's a hard thing for me. So that's really what led me to this decision to do this.
In Jayne's example, she is the perfect candidate for a facelift. She's 68, but she is taking great care of herself. She's got really healthy skin, but she has typical signs of aging. She's got a heavy banded neck with some excess fat deposits in the neck. She's got some sagging through her cheeks. In addition, she's got some areas where she's lost some fat volume. So in addition to performing the face and neck surgery, we're going to do some what we call autologous fat grafting. The changes we're going to create for Jayne are going to be nice and natural. And like I've told her, give us 2 to 3 weeks and she'll be walking around town and no one's going to be pointing their finger at her saying, hey, you've had a facelift. We do really expect her to have a nice natural result, maybe taking 15, 20 years off her appearance. I'm very grateful that Jayne is allowing us to document her entire facelift experience. So many patients come in, they don't know what to expect. So having somebody like Jayne enable us to document every step of the way is going to educate people as to how special this experience is. Hey.
Hi!
How are you?
Good to see
Nice
you.
to see you. You been well?
I'm great. Yeah, I'm great.
You worried about surgery?
Am I worried? You know, anytime you're doing any kind of surgery, you're a little bit nervous.
Yeah.
You know, but I have complete faith in you. I know that you're gonna do a great job.
I'll do the best I've ever done.
Okay.
So for
It's
sure.
perfect. That's all I could ask for. First of all, what type of facelift am I going to have?
Sure, that's a great question. It's very confusing these days because all these surgeons have come up with these very, very cute names for things that we've been doing for 30 years,
Okay, right.
The big name out there everybody's referring to is the deep plane.
Yeah, right.
And everybody comes to me, do you do the deep plane? I say, yeah, we've been doing it for 30 years.
Okay.
It's just now all of a sudden someone called it the deep plane.
Okay.
We reestablish a more youthful architecture in your
Okay.
face, and it's not just the skin.
Okay.
It's actually more about the deeper muscles and the fat deposits.
Okay.
So the deep plane refers to a surgeon, me, going deep below the muscles.
Okay.
And we have muscles in our face and in our neck. Loosening those up to a degree and then tightening those up. Think of a facelift in 3 layers. First layer we work with is the musculature of the face. In the cheek area it's called the smaz, in the neck it's called the platysma. But essentially we go below that muscle and we tighten it up just enough to get the natural results that we want. The second layer we deal with is a fatty layer. There's some areas where there's too much fat, like in the neck, in the jowls, so we address that. There are some areas in the face where, as we age, we lose fat volume, and so we add fat back in what we call fat grafting. The third layer of a facelift is actually the most simple, and it's redraping the skin.
Okay.
And it's not about pulling it really, really tight. It's about gently redraping it, smoothing it out, kind of taking it back in the direction from whence it came. And
I hope it remembers.
it does. It does. And if you overdo it, obviously you get these weird lines, and you can get some unsightly scars.
Okay. Okay.
And the end result is a very, very natural look that
Okay.
has taken 15 or 20 years off the appearance.
All right. Good.
All right, I'm excited for you.
I'm
And thanks for doing this
excited.
again. It's, people learn from videos.
They do learn
Yeah.
from videos,
Yeah.
and the fact that you're being so kind to me is
Happy to
it means so
Oh,
much
when I
to
met
me.
you, I said, I gotta do that. I gotta do that surgery. Let's make it happen. So,
Oh, thank you so much. I'm really excited. I'm really excited.
good.
Really excited.
all right.
So thank
Good
you.
seeing you.
All right.
All right.